Hey guys, I just wanted to share with you this really cool and kind of rare case that I came across recently. So, a client presented with neck pain, both anterior and posterior, which is kind of an odd presentation to begin with, um, and no incidences or trauma or anything. So, recommend normal treatment regimen. We get in there, we work everything. She comes back in and continues to have a little bit of pain, although it's resided a little bit. So I decided to send her out for x-rays. So we get the x-rays in. If you take a look here, first thing I say is, basic degeneration going on over here and a little bit of scoliosis or curvature of the spine. So we kind of treat it from that perspective. She comes back in a little bit later and still continuing to have pain, starting on the anterior and going back to the posterior again. So I decided to re-examine what muscle groups could this be, and the only thing I can think of that crosses multiple other muscle groups is the omohyoid. So I recommend we start examining that closely, and if you look at the x-ray really closely, we actually get to see what's called Omohyoid Syndrome, which is relatively rare. And the only way to diagnose it is off of an x-ray based on the displacement of the trachea. Because if you look at the omohyoid muscle right here, it actually attaches to the hyoid bone, goes underneath the SCM, and then comes down. So it will actually displace the trachea a little bit. So zoom in right here. Now it looks kind of midline to the vertebra because there's a little bit of scoliosis going on there, but it's hidden well because if you look at the lateral, it'll remind you that the trachea sits out front here, so it's not connected to the spine, and it shouldn't sit midline to the spine. It should sit midline to the neck itself. And if we get out our measurements tools here and measure it, we're going to see that that trachea is displaced by about 10 millimeters, indicating that the omohyoid on one side is spasming and pulling everything that way in terms of the soft tissue. So there you have it, omohyoid syndrome. Thank you.